Let me tell you something that should terrify every Canadian, even if you think this is just an Alberta thing. Because what's happening right now, this is the first domino. And every premier across the country is watching to see if it falls. So in case you haven't heard yet, Alberta just introduced draft amendments that would let doctors run a private system alongside the public one. They're saying it's harmless, that it's still regulated, no extra billing, no topping up fees, that it won't affect public care. But here's the thing about slopes. They look flat until you take one step forward and suddenly you're sliding. According to the Globe and Mail, under these changes, doctors would be allowed to quote you a price in writing, and you'd have to agree to that cost before they can even treat you. You're literally signing a financial contract even before you sign the consent form. They're also giving the government the power to decide what services can be offered privately and under what conditions doctors can bill in this new system. Now that might sound like control, but in every country where this has happened, including the US, these guardrails always erode. Not overnight, quietly, piece by piece. Still, I can already see what the comment section of this video is going to be full of. Our healthcare system is broken. Emergency rooms are packed. Wait times for specialists are months long. Hospitals are shutting down ERs. So why not try this? All right, let me school you on that. Every single country that introduced parallel private options, the UK, Australia, New Zealand, they all saw the same pattern. Public wait times got longer, not shorter, longer. Why? Because doctors follow money. Skilled staff follow money. Clinics follow money. When you create a shiny private lane, guess what happens? The public lane empties of talent, not patients. The rich get faster care, and the public system slowly chokes. And then politicians point at the underfunded public system and say, see, it's not working. Better privatize more. It's literally a self-fulfilling prophecy. Australia is the best example. After allowing parallel private billing, they watched public wait times balloon. It got so bad that state governments had to pour billions back into the public system just to keep it alive. And even today, Australians pay some of the highest out-of-pocket medical costs in the developed world. New Zealand, same thing. UK, you guessed it. Private options don't relieve the system, they drain it. And let's be crystal clear. We didn't get here because of the last 10 years of federal liberal BS ruining healthcare. Healthcare is a provincial responsibility. Under the Constitution, the provinces control the funding, operations, staffing, and oversight. Everything. So if you're angry about ER closures, underpaid nurses, surgical backlogs, or chronic understaffing, don't scream at Ottawa. Look at your provincial government. And if you live in a province that's been run by conservatives for years, well, you don't get to blame anyone else for the damage. Now, back to Alberta, because this is only the beginning. Here's the dystopian truth. Once you introduce a two-tier system, the public tier starts to starve. Doctors drift towards where the money is. Wait times grow. Access shrinks. And then the people who can afford it, they get seen. And the people who can't, they wait. And wait. And wait. And this is where people will say, well, I can afford it, so what's the big deal? Cool. Great for you. But this isn't about you, Chad. It's about the millions of Canadians who can't just drop $400 or $1,200 or $8,000 because a doctor's office is now a storefront. And I know some folks don't care about other people. But you know what you should care about? Bankruptcy. Because in the US, medical debt is the #1 cause of personal bankruptcy. People lose their homes because someone in their family got sick. Families are destroyed because an ambulance ride costs more than rent. People work full-time and still drown in bills because the healthcare system treats them like ATM machines. We like to pretend Canada is immune, that it can't happen here. But this, right here, is exactly how it starts. Not with fully privatized hospitals, not with $70,000 surgeries. It starts with just a few private services. Just optional, just regulated. Just to take the pressure off the public system. That's the future you're flirting with. Believe me, every province right now is watching Alberta like a pilot project. If it succeeds, if people accept it, if it slips by without pushback, you think your premier won't consider it? You think the consultants and the think tanks and the lobbyists won't pounce? Because make no mistake, once this door opens, the people who benefit the most are not the patients. It's corporations. It's the private operators. It's anyone who can convince the government that carving up public health care is good for business. And the real damage? It doesn't show up tomorrow. It shows up when your neighbor's kid can't get in to see a specialist for 9 months because half the specialists now work privately. It shows up when a clinic in your town closes because the doctor moved to a private center in Calgary or Toronto or Vancouver where they can charge 2, 3, 5 times as much. It shows up when people start delaying care, not because they don't need the care, but because they can't afford to start the clock on the bills. That's the future we're flirting with. A Canadian healthcare system that slowly mutates into the American one. Not because we voted for it, not because we asked for it, but because we didn't notice each tiny change until it was too late. So yes, this is happening in Alberta, but don't get comfortable. Don't think geography protects you. If this takes hold, it's coming to your province next. And when it does, the only question will be, did we stop the slide while we still had our footing? Or did we let Canada's most sacred public system turn into a pay-to-play dystopia where the size of your wallet decides the length of your life? Because this, right now, is the moment where we either draw the line or lose it. This is the moment. Right now. We need to scream no while we still have a voice. Peace out. And if you're not already following me, you should. It's going to be a ride.